Aloha, welcome to Living Delicious with Helena and the special series, Die Delicious. I know it sounds weird, but it's true. If you want to die delicious, you have to live delicious. To talk about dying, process of dying and practicality of it, today we have a guest from Compassion and Choices Hawaii, Juliet Bagley.
Hello.
Welcome, Juliet.
Nice to meet you.
Nice to have you here. I'm so excited to have you here. Can you please tell us what is Compassion and Choices?
Well, Compassion and Choices is an organization that believes that we need to examine better and have a better chance of living well at the end of life. And so basically what we do is our organization works for getting better choices for end-of-life situations in many states in the U.S. And we've just started a chapter here in Hawaii.
Yes, welcome to Hawaii. When did you arrive?
Well, I've been here for a long time.
Yes, I mean, your organization.
But Compassion and Choices were working back in 2002, but they were called Compassion at that time. So, yes, so they've been working at this particular issue and in Hawaii for some time now.
So the whole organization is just founded in 2002?
No, they worked on the issue when we had the 2002 Death with Dignity discussion with regards to legislation. So they've been involved at that time, and they were involved today. So.
Can you tell us a little bit about you and your background in Hawaii and the governor?
Right, I worked for Governor Cayetano back in from 99 to 2002. And of course worked very closely for the Death with Dignity legislation that unfortunately did not pass, but we were just 3 votes shy in the Senate on the last day of the legislature. So
out of
that
how
was
many?
Oh, that was the Senate vote. So what happened was we were 3 votes shy, and therefore it was it 14 to 11. So that was the vote spread. But that meant that we passed the issue through the House. So this House passed it and pushed that bill into the Senate. So that was very good. And of course, that was the first time that anything like that had happened in the United States. So Hawaii was a first. It was a first for having a piece of legislation like that, which was considered, not very positive in the sense that usually you don't have elected people get this type of legislation through because it's a very difficult legislative piece of work. Oregon did it through initiative and referendum, and so did Washington. So Hawaii could have been one of the first to do it legislatively, and they were not able to do that. But now we're at a different point in 2011.
What do you think your reason was?
Oh, in terms of why we didn't?
Yes.
Well, I think that what happened was people are fearful. And they don't understand there was misinformation that was given about what the process was then. And today, you probably will find people will be hearing other stories about things, and they'll be, have fear again brought up. And in fact, it's a very straightforward situation for people when they're in an end-of-life situation. So it's not.
When you talk about end of life, that means what? Last?
Well,
how long?
Well, the law in Oregon talks about when a person is in their end of life situation, they've been adjudicated by 2 doctors as having 6 months or less to live. So that would be considered an end of life time, so that they're considered terminal. That's not something, that's a medical term. In other words, that's not me telling somebody that they're terminal or whatever. Sure. That is a medical term. So there's a very set definition of what that means. And so therefore, when that happens, a person then has to make up, obviously, a lot of different choices about what they're going to do in the given time that they have. And some of those choices, which Compassion and Choices deals with, there are people that say, well, I don't want to live all the length of time for my illness. I'm just going to stop eating, or I'm just going to stop drinking, or whatever. There's different things that people can do to end their life sooner. In other words, have some control. And I think really that's what we're talking about, is people exercising control of their wishes. So to me, that's really what end-of-life situations are about, is exercising control.
So practically, with the law we have, with the situation there is, how does this work in practice?
Well, right now what we do, and if people find themselves in a situation where they're terminal, they need counseling, and Compassion and Choices, what their main thing is to do is has a very good consulting service for people who are terminal. And what we do is, I have this up here, it's 800 247-7421. That's the number that they can call. And there's really very good people there who are trained to speak about the topics that maybe some people have had difficulty discussing with their doctors, because there are some people that are not comfortable about those things. And of course, they need to be able to discuss these things. And the other thing is, too, is some family members may not be able to discuss it with other family members. So it's something that it's a good thing to get up and start and discuss. And I think Compassionate Choices has a very good way of addressing that for people who find themselves in the situation.
And what if people are just old, but they don't have any terminal disease?
Well, that's not...
They need some support, and
oh yes,
can they still come to you, or?
Well, I think that people, when they call, they don't have to be terminal to call about something. In other words, there's a lot of different things that weigh on us as we get older. Right?
Loneliness. You maybe just lost your spouse or somebody, and they're feeling they want to die as well.
Yes, but I think I don't want to walk down the path of saying that people who seek an end-of-life situation are just depressed, because that's and that's really not an I don't really find that a very
who besides terminally ill patients at the end of their life, who besides them can call this hotline, and what kind of help they can get?
Well, there are family members who may have issues about how to address better situations within the household. So, and there's, because what you find is that in end-of-life issues, there's a lot of ignorance that can happen. You don't realize if you did this, you could make something easier. I should explain for just myself. Just
give us the example.
This of course is just as an example. I would just say, sometimes in an elder care situation and a patient is terminal, there are little things that you can do to make things easier. And quite frankly, when you're able to speak to someone who's been involved in those situations before, that's something that that can be very helpful. So there's about our consulting services offer a lot of help within family and family members to discuss situations because they have a member of their family who is terminal.
So let's say my grandma. I love my grandma. She's 89, almost 88 now, and if she wants to do that, if she's here in Hawaii, and she would like to make a choice to die with physician assistant, what can she do?
Well,
today,
see, what would happen is if a person is not, you have to be terminal or in intractable pain and all those different things that go with that. But what you would do is you would call the consultant line and talk to them, because of course people there can extract information to get things together so that they'd be able to really give good advice given the circumstances. But I think what really you need to recognize, though, is that when people enter into these types of discussions about their end of life planning and all the different things that go with that, that's what Compassionate Choices involves in as well. So they'll ask if you've done your advance directives, if you've gotten different notices put together with signatures together, so that you'll have information for physicians or family members about what your wishes are. I mean, there's all different things that go about the planning of your leave taking. I mean, and it doesn't mean that when you do those things that you're planning to die now. I mean, that's another thing.
It's something like just putting on the will together in a different way.
Well, but advance directives are not a will. Will is about your assets, right? But advance directives about what's going to happen when you advance with your disease. What are you going to be allowing to have done to you? What will you want to have, no. What I don't want food, was it tube feeding, or I don't want, the different, different
I
things
don't want
like,
any kind of resuscitation.
I don't want to be resuscitated. I mean, there's all these different things that you'll have in your advance directives. And when you have something that happens and they come up, you expect the doctors and the emergency people to follow advance directives, or at least the medical professionals. So, I mean, those are...
And do they read it? Because I know of the example, he didn't want, my friend's father didn't want any, don't touch me. And they caught him in an emergency came in the ambulance,
Yes.
in the car. They started, and then he lived like a vegetable for maybe 2 weeks, until they pull out the plug, and he didn't want.
And those are issues that happen because of emergency protocols.
Yes.
And those are unfortunate and terrible to happen. And what is happening within some of the areas of compassion and choice is what they've been looking at, is how to go about minimizing and reducing those things from happening. In other words, to have advance directives taken seriously. Taken seriously. I have myself had a very good friend whose advance directives were ignored by a hospital in Hawaii, and she was kept in excruciating pain, I believe, for a week before she finally passed away, and I was with her for those times. So I know very well that there are some things that have happened that we don't have control over, but the issue is, what can you, as a person who is faced with an illness, put out as your desired wishes? And how do you go about making sure that those things are followed? It's not easy, but I think we're moving in a direction where these things will be taken more seriously in future.
So professionally and as a friend, why do you think that has happened to her?
I think that what happened to my friend at the time was that there was an intransigent doctor. And that's what happened.
So was that addressed?
Yes, it was addressed quite well, and I don't think it will happen again. So that was rather than be more public about that. But I think that there was a how do I say it? That was handled, and that was handled by the family and the institution where the issue happened.
Wow, wow. Okay. Sometimes somebody has to, so to say, pave their life to support the whole generation that comes after.
Well, I think the person, my friend, when that happened, it was as if she was being used for those purposes, yes.
Oh, really?
Yes. I mean, that was what she would have wanted to, because she was a trailblazer.
Wow. Wow. So I see the tears in your eyes.
Yeah.
So yeah, thank you. Thank you for sharing. So if somebody is terminally ill and it's in excruciating pain, and it's really end of life. What can they do in Hawaii today if they want to choose?
Well, as Robert Orfali has spoken, and Dr. Nathan has said, he would be willing to give a prescription for people who were in a position where they wish to have a medication to take that could basically end their life.
So will that prescription come from, where would it come from?
A pharmacy.
In Hawaii?
I imagine so. I mean, it would come from a pharmacy. There'd be nothing, it would just be a straightforward situation. A patient would then have that, so they would feel comfortable. A third of the ones that receive medication in Oregon, in other words, people who go through the Death with Dignity process in Oregon, a third of them do not use the medication.
Yes.
They just have it sitting there at home, just in case things get to be, in the progression of their illness, too much.
Let's say somebody is watching now. I have in my mind right now a friend who is dying of cancer in excruciating pain, and he stopped chemo and everything because and he's really suffering because his wife, they love each other a lot.
Yes.
So let's say he's watching this. Can he, at today's date, do something really about it, or this is still just imaginary?
No, I think like I said, I think that what people need to do is they need to call our 800 number, because quite frankly, the hospice programs are there too. So if someone were not involved in hospice, let's say, and they were just manning it up or whatever and working through this illness and it's eventually going to take them, that's not the way to handle things. They need to go to hospice. They need to discuss with hospice.
He calls and he says, I would like to have a pill. I would like to have that choice and to do it in a peaceful way. Is that possible today in Hawaii? Or not yet? You
would not have a situation just like that, because what happens is people have to, in other words, no one is just calling up and getting medication for anything like that. All these things involve consultations, they involve discussing with the person, they involve discussing with the family. And quite frankly, currently people within the hospice program, there are some things that can be mitigated. things that may be making things worse for that person. So they within the hospice program, they could be fine. In other words, they'd be able to handle exiting in that program. They would
in
wish.
alignment with the way they lived.
Yes, in alignment with the way they lived. So there's that element of it.
So then I would really like to get to this specific thing. If today we have somebody who is really completely qualified with their disease, the progression, the pain and everything, and they are choosing it, they would like to do it, can they do it in a state of Hawaii today?
Well, I would say that according to Catherine Tucker and Compassion and Choices, yes.
Yes.
They should be able to do it.
Dr. Nathanson would prescribe?
Dr. Nathanson will prescribe, yes.
Can you tell us more about him? Who is Dr. Nathanson?
Well, Dr. Nathanson, I just have his bio here, so I just wanted to make sure that I don't leave anything out. He's a physician who started hospice in Hawaii.
Yes.
So he has a long history. He earned his medical degree from Tufts University School of Medicine in Boston, and he completed residency training at Tripler. So he's long years here. And I like to say is he's been living in Hawaii since 1957, which is the year I was born. So I always sit there. So I think, wow. Anyway, he retired after 37 years. And he's a co-founder of Hospice Hawaii in 1979. So he's somebody that's very, very familiar with the whole plane of this issue.
Yes.
So Dr. Nathanson is a true physician.
So he would do that? Will he later be prosecuted?
I'm not with the Attorney General's office. I don't think that given the legal framework that Catherine Tucker has done for Compassion and Choices, that prosecution would make any sense.
Would he be blasphemed, judged, criticized in any way?
But remember, everyone is blasphemed and judged for everything that
for
they possibly
have done.
For
what you listen, what you eat.
I mean, when you get down to it, really. And I think that people who go out and do things that really make change for others are not necessarily always understood completely. But I do think that Dr. Nathanson and Compassion and Choices and people who have this belief as I do, there will be criticism. I can't block people from criticizing.
Are you willing to be on the show with the opposing side? To do a little debate or a...
I don't mind doing that. I don't know that I'm the best expert for doing something like that because I am not a lawyer. But
of course, I would love to get people from opposing sides to get, because everybody will die. And we can be blind to that point until we start seeing people die.
Yes, and
I grew up in war. I've seen, so my best friend died.
Yes, so you know that things are really terrible.
But that happened. It was not a terminal disease, still.
Yes.
I don't know what's worse: watching somebody you love slowly die, or somebody you love just get
gone. Yes.
So I would like to get clean conversation.
Of course.
Please, with both sides, so we can really help viewers and help the whole country, the whole state at least, with coming to the end of life with the best moral dignity, heart dignity, any religious, whatever we feel right. Yeah. So I'm grateful you would come.
Oh yes, I came to this issue myself because of my experience that I had in 1998.
What was your experience?
And I had a friend who passed away from cancer, and I cared for them for some time. Since that time, I have cared for other people, 5 people who have passed away. And the last person who passed away was in March. And
Here
it was in Hawaii. And it was very good. It was a very good death, and Hospice Hawaii came out, and it was wonderful in terms of being able to go through the process with him, and he was able to go in a very peaceful manner. Now, the only thing I can say, though, is that hospice came, and it was 7 days before he died. So we could have done better with being in hospice sooner. So I think that again, that's another issue that happens when people don't want to talk about dying, don't want to talk about death, don't want to basically have those conversations, or feel constrained and can't have them with their doctor, which I'm really grateful with Compassion here today, because this will cause some people to say, I need to ask my physician what his position is on this.
This topic really matters, and therefore it's tricky. Do you think they would try to repeal the law?
Oh, with the repeal idea, I think that that would be a very unwise situation, because you would then have doctors who right now do terminal sedation. In other words,
but not in Hawaii.
Oh, in Hawaii. In Hawaii,
okay.
we do.
But not with the...
So if they were to go out and repeal different parts, it's like, well, wait a minute, because they could turn things that are being done right now as a practice by physicians,
but
and
that's
make them
not done
criminal.
voluntarily to the not by order of the patient. That's done because of the...
It's a normal practice,
Yes.
medical practice.
It's time to pull out.
Well, you do. So the problem is, if they start interfering in some of the divining statutes, you can run the risk of criminalizing medical procedures right now that are totally, I mean, without question. I mean, you have to look at things like medical practice, where someone is, let's say that they're passing away, but they have a pacemaker. There's a medical best practice about the removal of the pacemaker, and that causes, quote, death, right? But it's not murder. So the question is, when you go about and you would start to rewrite sections of those existing revised statute, the question I would have is, you have to be so careful. I mean, I would think, and again, I'm not a lawyer, but I would feel very, if I were a legislator, I would feel very nervous about doing that.
Let's see. What do you think the future is?
I think the future is that our people in Hawaii will have more choices about that they'll have in order to, at the end of life, they'll have more choices, and possibly there'll be less misery and suffering for many, many people. And I think that that's something that we can all support. Now, I understand there'll be criticism, but quite frankly, I think we need to start looking at things more realistically.
Okay, thank you so much, Juliet. I appreciate. And again, if you have a family member or somebody you love and you would like to offer them any help and support, please let them call the number. Can you read it?
800-247-7421.
800-247-7421. Call, get some information, live delicious, die delicious, make some compassionate choices.
Thank
Do
you.
you have a message actually for the end?
Well, I think you just have to really think about this and not cry as much. You just have to think very, very carefully.
Very careful thinking. The hardest time to think carefully. The hardest
Very,
time
very
to
hard.
keep your... Not only it's difficult to lose someone you love, and all these changes of life that happen after. It's one of the most complicated and stressful times in life. Thank you for being here. Thank you for bringing your organization here and helping Hawaii. Thank you so much. And again, one more time, 1-800-247-7421. Live delicious, die delicious, and see you next time. Hopefully we will have a debate so you can see the both sides and decide for yourself. Aloha.
Yeah.